Tansa. I'm Tara Hodgson and this is Treaty 10 News.
I'm Veronica, Dr. Veronica McKinney. I'm the Director of Northern Medical Services, and that's a division within the College of Medicine at the University of Saskatchewan. Well, I would say number one, COVID isn't over. It is still there, it's alive and well, and there are still people that get COVID, and there are still people that are getting complications from COVID. Some people have those long haul effects they talk about. It affects the brain, it affects the kidneys, it affects the lungs, the heart, the intestines. And I think the other thing is that it's still important to get vaccinated. In Treaty 10, we know some of the lowest numbers of vaccination are in Treaty 10 territory. And yet we have good access to those vaccines. We know that getting one vaccine is not enough because this virus is smart and it keeps changing and melding into something different. And so now, it's changed multiple times, and so we need at least 3 shots of that vaccine for it to be effective. And if you're eligible for a 4th shot, get it, because they know that if you haven't had a shot for about 4 months, your body's ability to fight those infections decreases. So what this vaccine does is it just helps your body to, I always say it's like having a picture. Your body has a picture now of what they need to look for, and they can fight it off much quicker. And so that's what that vaccine does. It's very safe. They've had millions and millions of people have the vaccines, and they've really had very little in the way of reactions. Most common is a sore arm that people would get, but for the most part, people do really, really well. But yeah, and kids can have access to the vaccine too. Even 5 and older now, they can get the vaccine. And that's where the biggest numbers have been coming from recently, is from the schools. The kids have COVID and they're still going to school, and parents don't want to miss work because they're not getting paid, so they're not staying at home when they're sick because they kind of feel like maybe it's not that bad and they can manage. But it's better to stay away and to protect your family, your community, and try to keep away from them for 5 days, they say. But as long as you have symptoms, you should stay away from everybody, and for 48 hours after you're symptom free. And wearing the masks is really important, especially inside, because we know this virus now, it's in the air. And so we can walk in and you won't see it. You don't have to be really close to somebody. If they've sneezed or something in the air, then those viruses are there. So we can pick it up pretty easy. So wearing a mask actually makes a big difference. They say even those, just the regular masks, you can decrease the virus from coming to you by about 50% if it's cloth, 60 to 65 if it's one of the regular medical ones. And if you use the N95s, that's over 80%. They say actually up to 95%, but at least over 80% for sure. So there's things we can do to make it better, and we can make it better for all of us. It's about a mask is not perfect. The vaccine is not perfect, but when you combine them together, they're pretty strong. When you meet people outside instead of inside, or if you're inside, if you have good air circulation, like if you're able to get HEPA filters, or purifiers, those types of things, then that makes it better. So there's lots of things that we can do to make it better, and if we don't do those things, it can be much worse. So it's actually not unlike any other things. Even when you're sick, we know that if you drink fluids, you have, you rest, those are things you can do to make it better. It's not going to completely get rid of it for you, but it'll make it better. Yeah. Same thing with the virus. There's things that we can do to make it much better. The thing that I think that's scary about the virus, and we've gotten used to it, is how many people are dying from this virus. It's crazy. I mean, anything else that would have this kind of death rate, we'd be hiding for cover, and we'd be saying, what the hell's going on? Why aren't we doing more? We're actually seeing a little bit lower numbers in terms of the total number of people that have COVID right now, but we're also seeing, again, increases. So they think we might be heading up again. We know there's another couple of variations that started off in Africa this time, and now it's in the States. So it seems like it's a matter of time before we get it. And I know it's hard because you try to keep up with all this stuff, but the funny part is what we can do has not changed. It's the same things. Get your vaccination, wear a mask, try to, be outside, try not to get too close, have your people that you're with, your bubble, they call that. And, those people you can be a little closer and give hugs and kisses to. Of course, grandkids or partners or whoever it is that you choose. But, generally we can still meet with people and talk with people. We just have to do it in a safe way. And so those things is what they're talking about now when we talk about living with COVID, is trying to do what we can to protect ourselves, to protect our families, and to protect all the people that are around us, our communities, the Treaty 10 people for sure. So those things haven't changed. I suspect they won't change. And we know there's even other viruses now too that are out there. They don't seem to be as bad, but we don't know yet. Things like this monkeypox that's come out now too. So viruses are around us, they're all around us, they've been there for a long time, but these ones now that are coming out, the COVID is a particularly strong one, and that's why they've called it a pandemic, but that pandemic is not done yet, and that virus isn't done yet. Definitely, I think from a politics point of view, it's been tough to get on top of a pandemic, and especially when you want to promote your own political viewpoints. There's an appetite for people to hear that it's over because we're all tired of this. We don't want to keep this up. We are thinking back, geez, wasn't it nice when we didn't have to worry about this? So we all want it to be over. So that's an easy win for a politician. It's not the reality though. And science is, it takes time to get the information. And, any scientist that you will talk to will always say nothing is 100% and nothing is perfect. Whereas if you talk to a politician, they'll guarantee that things and yet when they're done, when they get voted out, you go back and nobody goes back and says, oh, wait a minute, didn't they say this? That's just the way it is. That's how it is. That's the way it goes for sure. But there is a push, and particularly from certain provinces, that seems to be much more political, and it's more to gear up their political parties. It's not really so much based on the science part of things. So that's made it really challenging, because I know even people that are working within the system have been really frustrated and trying to get people to understand what they can do to make it better. And this is where the burnout comes in, because we're losing doctors, we're losing nurses, and when you are told that it's over, but you're seeing the people right in front of you, you know it's not true, and you know that there's less resources being used. It was a way, I think, for the province to say, look, we don't need to put more resources here, so we're not going to do that anymore. But guess what? Those same workers are still working night and day, and many people in Treaty 10, many of the workers up there have been working really, really hard for a long time, and our communities have been working really hard for a long time. So it's easy to just sort of say, yeah, I think I'd rather think of it in that way. But either way, even endemic, that still means it's out and about and it's causing the problems. So it really doesn't change anything. It just, at this point, we're just slicing words, whatever way you want to call it. But that bug is still out there, and it's still affecting us, and it's still killing people, and it's still causing long-term effects for people. And, I'm seeing a lot more of that for sure. A lot more people that were really healthy people, active, doing all kinds of things, and now they're completely debilitated. And that's the part that I just can't get over. And young people too, people that can't work more than 5 hours a day because they just can't, they don't have the energy, their brain isn't working. I was talking to one of my doctor friends who got it, and he's had a hard time finding words. He knows what he wants to say, but he can't think of it. It's almost like a stroke patient. So we're seeing so much of these kinds of things, and we don't even begin to know how bad it is or how many people will have those types of effects, and what we can do about it, or if it's even going to get better. So there's a lot of pieces to this that we haven't even begun to know. And I really worry about the people in Treaty 10, because we know that access to things like speech pathology, physiotherapists, even to family doctors is really difficult for a lot of people. So, these are tougher things to get diagnosed, and then tougher to get access to services that you need for sure. Again, the other thing with those tests, though, is some people are finding they don't test positive right away. Right. Sometimes it takes a few days of symptoms before you actually test positive. The other thing is that sometimes, and there have been people that, their partner, for instance, has had tested positive. They're sleeping with them in the same room, and they themselves did not test positive. But you still might get COVID. And it's interesting. So I think you're right in terms of making sure that if somebody's positive, to try to keep them separated from the rest of the family if you can. Make sure that they're wearing a mask anytime you're opening the door to the room that they're at. You know, maybe when you're bringing them meals and things like that. Ideally, if they could use their own bathroom, but if they can't, that's okay too. Just making sure that you're wiping down, you know, those little Lysol wipes are handy for that. You can wipe the doorknobs and the taps and then the handle to the toilet. So those things would be helpful for that. But the other thing about these, you know, about testing positives or symptoms, you might not have any symptoms. I've had patients or people that I know who's had 2 people who are positive. Just out of curiosity, they thought they'd test themselves. Well, lo and behold, they're positive. And they don't have any symptoms, and they didn't have any symptoms. But some of those same people then later on developed the long haul symptoms. So just because you've had symptoms doesn't mean you're going to get long haul, and just because you've not had symptoms doesn't mean you're going to get long haul. So that's what makes it confusing. It's hard for people because you kind of feel like throwing your hands up in the air and going like, well, what the heck? You know? Yeah. So it's these viruses, like I said, they're pretty wily, and we all react a little bit differently to them, and they can get into different spots than what we expect. It's just like, again, I kind of liken it to maybe a herpes virus, like the cold sores. Some people will get those and some people don't, even though they've been exposed to that. And we know that that virus lives in that nerve area forevermore. And so we know some of those viruses do that. We're starting to think maybe COVID is like the same thing, and that's how it's getting into these different areas of our body. And so where it does that for you, how do we know? We don't know. Yeah. So that's the thing. We're better off to just stay away from this darn bug if we can. Try to fend it off. I do think some of the traditional things that we do too are healthy, like making sure you're out there moving every day, like getting outside. If it's picking medicines or berries or, you know, going trapping or hunting, whatever you do, those are good things to get out and about. The land is healing for all of us, for sure. So the more we can get out, the better it is. And I think our foods are good. Our traditional foods are good. The meats that we eat, like the deer and the fish and moose, if you can get it, any of those things, they're really healthy for you, and they keep you healthy and strong. And those things will keep your sugars down too, which is also really important, because if you're diabetic, then when you got higher sugars, you're more prone to infections. So trying to keep ourselves as healthy as possible. There's lots of different traditional teas that people will drink, and that's actually really healthy too. Keeping yourself hydrated, using our traditional ways of keeping our immune system strong. Those are all really, really good. And then the other thing I think of is just keeping connected with people. So we still have phone, we have FaceTime, we have all kinds of different things we can do now. Maybe we'll talk over the fence more, I don't know. Well, my favorite explanation that was given is it's like birth control for the virus. So basically what it does is it stops the virus from replicating, from you know, growing and you know, dividing, that type of thing. So if you can get it early enough, you can actually stop that virus from growing within yourself, and then you don't tend to get as sick because you've only got a little bit of the virus. So you have to get that Paxlovid within 5 days of the symptoms. They're trying to make it easier and easier to get. So you can call your family doctor, you can call your clinic, the nursing station. So nurse practitioners, doctors, and now even pharmacists can prescribe this for you. And you can also call 811, the health line, and they will assess whether you're eligible for it or not. And if you are, then you can go ahead and get it. And it's only taken for a short time, and then that just helps you to fight that virus, so that virus doesn't get a chance to really go crazy and develop in your body. So it makes a big difference. Again, you might still have some symptoms, but at least we know that you won't get to like the intensive care unit. At this point, we always say, like, if you can stay out of the intensive care unit, if you can stay out of the graveyard, we're doing good. Right. You know, that's the main thing. But even preferably keeping you out of the hospital as well. So it isn't the same as the flu. That's the other big thing I will tell people. We don't have the numbers of people dying from the flu. In 5 years, we've never had the amount of people we've had die of the flu in the last 2 years. So this is very different. And it can be mild in symptoms for some people, but for a lot of people, it's not mild, and it can be it really knocks people out. And even though they're able to get better and they haven't had to go to the hospital, you know, most people will tell you it's not the same. They've never been quite as knocked out as they have been with this. So yeah, definitely try to isolate if you can, if you're sick. And if you are somebody that's looking after somebody who's sick, or they have somebody in your house, keep testing yourself, because we want to make sure that you're not positive as well. And, you know, if you do turn out to be positive, well, then, you know, try to stay away from others who are not positive as well. Yeah. And stay home from work. Don't keep going if you're sick and if you're positive. I think they're good. I mean, you have to be careful. Of course, if you, like chaga, for instance, it is known to be immune building, and it's known to fight different things, including some people use it for cancer and stuff. But if you're on medications already, it does affect the liver, so you have to be careful not to take too much of the chaga along with your medications. So just checking with the pharmacist to make sure that what you're taking is not going to interfere. A lot of what we do are you know, different plants and things, even berry tea. I mean, those have strong antioxidants, which helps our bodies to fight the infection. So they're all good. I think, you know, even if you don't believe in the medicine themselves, it actually is good to keep your fluids up. So I don't see that those are problems for people. I just think the one thing you should probably check is just to make sure that there's no interaction with your medications. But other than that, usually it's pretty good. And the one thing I tell people too is that when we make our teas, and most of you will probably know this, you don't generally boil the water, like you boil the water, but then you steep the tea with what your medicine is. Or if you're making a pot of it, you usually make it on the stove, but don't boil it, because it takes out a lot of what the active ingredients are by boiling it. And then you can keep it in the fridge if you like and drink it cold, especially in the summertime. You can make a nice tea out of it, a cold tea drink. But yeah, they can be really good. I think they're actually pretty healthy for us, for sure. So one of the things when this started, COVID, a lot of the elders, I was lucky, I got to spend some time with various elders from different places. And many of them told me, and told the people that I was with, that this was a time to go inside and to heal. And I think one of the downsides to this is if you don't do that, if you don't spend the time on yourself and with your family and with your community, the problem is that it's very difficult right now. It's a difficult time. People feel hopeless. You know, people don't have access to do the things they normally would do. And they're not feeling good about things and scared that the world is ending. And so a lot of people are turning to alcohol and drugs. It's a way of self-medicating. And you know, the other thing that I think about too is, like in my family, my grandmother was a survivor. My great-grandmother was a survivor of residential school. My mom was raised by her. And one of the things that my mom always noticed about her grandma was that she, as long as she was busy, she was doing traditional things, she was busy, she was okay. But if she wasn't, that's when she would drink. And I noticed that with many of my family. I noticed that with many of my patients. I noticed that with my mom. My mom was not a drinker, but she kept herself busy, and I think it was just to keep her mind off of some of these things. And we all have different ways of coping. But when we've got that added stress of COVID and all the things that are going on and the uncertainty of everything, I think it really hits home for a lot of people. I know when I've talked to people from Treaty 10 territory, they talked about how when there was lockdown, they felt like it was back in residential school or back to the past system. And that really triggered them. A lot of our people suffer from post-traumatic stress disorder. A lot of people have anxiety. A lot of people have depression. So these things are not making it better, it's making it worse. So I think in that way, one of the things I think is the most helpful is the more we can get back to our traditional ways. And even if you haven't learned those or have never been exposed, talk to people, find out. We're better to talk to one another and support one another. And that's another traditional teaching that I've always been given, which I try to practice, is that we're here to support one another, to help one another, not to knock each other down. So, you know, let's try to see if there are ways that we can help one another. And addictions really is just somebody who's trying to self-medicate. So if we look at it in terms of, instead of, why are you doing that? How about what happened to you? What can we do to help you? And one of the things I was just talking about is there's something called adverse childhood events that we know when kids are exposed to different traumas, things like being taken away from their parents, abuse of all kinds of different sorts or neglect, you know, domestic violence, mental health in the family, all kinds of different things like that, that it affects how their brains develop right from when they're in the mom's tummy and then all throughout their childhood. And so those brains have an ability to react really strongly to emotions because that's what they've had to do, but they didn't have some of the other parts develop as well. And so what those kids now are doing when they're growing up, or even as teenagers, is they're trying to self-medicate because what they're doing, what their brain was able to do when they were little, is not working anymore with all this stress and trauma. So if we look at it from that way, about all the stress and trauma people are going through, our natural inclination is to help them. Let's try to help. Let's see what we can do. And I believe in Treaty 10, that's how people have survived for hundreds and thousands of years, is helping one another. So these are, I think, in a way, an opportunity to come back to ways that people have done for a long time, and really, you know, change, like really bring that more to the youth especially, and make sure that they're given those tools that will help them and build resilience. The other thing I think of is I was taught some of the petroglyph teachings, and they talked about something coming that will destroy us or bring us together, and it's only through coming together that we will conquer this. So I believe that too. We need to help one another. We need to be strong together. We have a different population than the rest of the province. Greater than 85% of our population is Indigenous. That's higher than the Yukon. That's higher than the territories. That's even higher than Nunavut. So we have a unique group. We're not all the same. When we use the word Indigenous, you guys know better than me. Everybody is different depending on where your community's from. I can tell where somebody's from by how their face is, you know, how they speak, what words they use when they speak. You can tell right away we're all different, and that's a beauty, that's a strength. And having that strength of the culture is also great. So that means that our languages are strong in the North. We want to keep it that way. Those are where all the strengths of the communities lie. But that population is also very different. We have a lot more younger people than we have older people, whereas the rest of the province is very few young and a lot more older people. So when they're coming up with policies, or when they're developing ideas of how they're going to approach health for the province, our North does not fit into that, because it's the exact opposite. A lot of the things that we're experiencing are not the same as what's happening down south. And we know for Indigenous people that we are overrepresented in many medical issues, but chronic disease, all these different things, we get them more often, and we get them worse than what they see down south. So that we just don't have the tools right now to be able to address that in the current systems. But maybe we need a system that we focus solely on what's going on in the Treaty 10 territory, rather than trying to follow along with one template for a province that doesn't match what our communities are reflecting, for sure. So those are things to think about. In BC, they did the First Nations Health Authority, where they have their own health authority for the First Nations communities. We also have a similar thing that we did way earlier in the Athabasca Health Authority. So they put together the federal, the provincial, and the bands came together and developed their own system. So there, you know, I know there has been some talk about that, and you know, more from communities, I would say, but that is something that maybe needs to be thought about at some point, because the way that we work together, the way that we have to come together, and the way that our communities are is very different than any place else in the South. So in order to have stronger advocacy for what our needs are, and for being able to do those things that we know we need to do to make the health better, to make our communities stronger, I think sometimes we need to have a way of advocating for those policies that reflect our communities, not the province as a whole, which really doesn't reflect our communities. I really love our communities. I spent many summers up in the North, as I talked about, and I just think it's such a gift, and it makes me sad to think of things like climate change. I almost get choked up when I think about that. But I think it's so important that we protect that, and we protect our communities. And the people are amazing. You will never find people like that anywhere else. So we need to make sure that we are looking after ourselves and each other. You know, our kids watch these TVs and they think, oh, all these things are going on, and they want to eat all these fast foods and stuff. It's what's killing us. That's not us. We need to live who we are and be who we are and find our strengths. And like the elders always taught, we have seeds within each of us, and if we just nurture it and grow, they will develop. So just have that faith. It's there. You have everything you need right there. Just stick with it and keep going, and don't give it up.
Hello, dancer. How are you? Dancing it up. some tea.